If not, we could be in the very same situation in July. I've been speaking to Professor Hayward from UCL. He advises the government's SAGE committee and Nervtag, the new and emerging virus threat advisory group. And I began by asking him what the numbers tell us this morning.
Well, I think it's now very clear that we will have a substantial third wave of infections. The really big question is how much that wave of infections is going to translate into hospitalizations. The fact that we've got 55% of the adult population double vaccinated means that this would be substantially less bad than it could have been, but we still don't know exactly how bad it could be.
And what we do know is that this new variant is at least 60% more infectious, but also more likely to put people into hospital. Looking at those two numbers, what does that tell us about the weeks ahead?
Well, I think 60% more infectious is extremely worrying. That's the main thing that will drive the speed with which the next wave comes along. And the fact that the level of hospitalizations from this infection appear to be maybe up to double those from the previous infection is, of course, also extremely concerning, even in the context of people having had a single dose of vaccine. And I think one of the key problems is the first dose of the vaccine really only reduces the risk of infection by about 1/3. And so we really need both doses before we get to a good level of protection.
Yeah. If you look at all of those graphs, they're going shooting up quite fast. Do you think there is any chance at all that we will lift all restrictions going ahead from later in this month?
Well, I think when you look at those graphs shooting up, what we're really seeing, depending on where you live in the country, is a doubling time of somewhere between every week and every 2 weeks. If we look at the ONS infection survey, there's about 1 in 500 of us infected so far. And that may not sound much, but actually that's only 3 or 4 doubling times away from reaching the levels of infection that we were at the height of the second wave of infection. So I think if we were to open up more, that will just really fan the flames and lead to this increasing even faster.
So does that mean personally, I mean, I know you're a scientist and you hover over the data the whole time, but personally, in your opinion, would it be irresponsible to open up completely on the 21st?
Well, the way I look at it is we're driving down a road and you're coming up to a bend and you're not quite sure what's around that bend, but you think there might be something bad. You're going to put your foot on the accelerator. If anything, you slow down, not speed up. And I think it's analogous to that. I think we've got to be really cautious because there is still a substantial chance that we could have a wave of hospitalizations that could put very substantial pressure on the NHS at a time that it's really trying to deal with the enormous backlog of cases of people waiting for hospital care.
Now, as I understand it, whatever happens, at some point there is going to be some kind of new peak. Scientists talk about the sweet spot. So is there a danger, if we delay too long now, that we push that peak of infections towards the winter and the autumn when the NHS is already under more strain?
Well, I think we made that mistake in the first wave of the pandemic, thinking, oh, we've got to get the timing of this exactly right. The fact is, if you've got a big wave coming towards you, you need to start to take action rather than just wait and see what happens. So I think we deal with the winter when the winter comes.
I want to ask you about some other figures from Public Health England, and this is of the 42 people who died from the Delta variant in the last reporting period. It turns out that 12 of them died 14 days after their second dose of vaccine. So 12 of them were double vaccinated and died nonetheless. How worried should we be about that?
Well, I think any vaccine is not 100% effective, so we expect some of the deaths to happen in people who have been fully vaccinated. It looks like double vaccination is certainly at least over 90% effective in preventing infections and deaths. But nevertheless, if you have very high rates of infection and that's against the background of an increase in severity of the infection, then yes, you would expect deaths amongst people who have been double vaccinated. On the other hand, I don't think that should be a huge concern for people who have been double vaccinated. Their individual risk may be quite low.
We used to have the highest vaccine rate in the world in terms of the speed of vaccinations, and we're now falling behind lots of other countries, including France, Italy, Germany, Uruguay. Are we we vaccinating fast enough to beat the virus at this point? The Prime Minister talks about a race between vaccinations and the virus. Are we vaccinating fast enough to win that race now?
Well, I think when we talk about that race, obviously there's two sides of it. One is how fast we can vaccinate, and the other is how much we can slow the virus down through surgical restrictions. I think we're obviously vaccinating very much as fast as we can, and amongst the fastest in the world. But we still have a substantial number of people who have not been double vaccinated, and that's the absolute priority, is to get those second vaccines in. If it wasn't for the level of vaccination that we currently have, we would be in a very different situation than we are now, and really extraordinarily concerned.
Never mind double vaccination. I think there are 11.5 million adults in the UK who haven't been vaccinated at all and are entirely unprotected. Would a 2-week delay in the restrictions being lifted be enough time to vaccinate those people?
I'm not sure it's that helpful to put exact timings and things like that. I think throughout this roadmap process, what we've needed to do is to really follow the data along the way and then take action. And I think when you put arbitrary dates on things, that creates an enormous amount of pressure and expectation.
Do you think we should be vaccinating school children?
I think there is a case for vaccinating school children, but not until such time as we've vaccinated the adult population.
Professor Hayward, I guess a lot of people will be watching this and thinking, hold on a second, we were told that we were going to vaccinate all the most vulnerable people and then we could open up again. Why isn't that happening?
I think the reason that it's not happening is because no vaccines are 100% effective, and because we have a new variant that is much more transmissible and has a higher level of severity. And that means that despite the fact that a high proportion of the vulnerable population are vaccinated, we may still end up with many, many people in hospital. Now, fortunately, it looks as though the people who end up in hospital are much less likely to end up in ITU or to die than they were previously, but still, going into hospital will be an unpleasant experience. People may continue to be ill for months after they come away from hospital, possibly longer. And of course, whenever somebody's in hospital with COVID, then that causes disruption to the NHS and stops us working through the backlog of activity that we need to catch up on.
Professor Hayward, some really hard decisions coming very, very soon. Thanks so much for joining us this morning.